Now, the World Health Organization has approved the first malaria vaccine in history. WHO experts say the vaccine, Mosquirix, could save tens of thousands of lives every year because the real-world test of the jab showed it prevented 30% of severe cases of malaria, even in areas with high uptake of their measures, such as bed nets impregnated with insecticides. Now, in a statement issued on Wednesday by the global organization, its Director General Tedros Ghebreyesus described the development as historic. World Health Organization said that the recommendation is based on results from an ongoing pilot program in Ghana, Kenya, and Malawi that has reached more than 800,000 children since 2019. For greater insight into this development, let's turn our attention to Professor John Nwangwu, a public health doctor with expertise in infectious diseases and epidemiology. He's a consultant at the World Health Organization and a professor at the Yale University and Southern Connecticut State University in the United States. I want to say thank you for joining us. And let's put it out there. This vaccine for malaria, how groundbreaking and how game-changing is it?
Thank you, Aaron. It is indeed very, very, very important. For many, many years, for decades, we've been wondering, when are we going to have it? And in fact, when COVID came, we were discouraged, wondering that if COVID would take over the efforts being made in the malaria vaccination. I do think that it's one of the most important efforts that became fruitful. Putting it in context, what we have so far seem to have plateaued, seem not to be working effectively. And what I mean is in terms of the bed netting, the medicines we give, they seem, with resistances of these parasites, seem to have got into a dead end. So a vaccine, it's really a fresh breath, coming our way. And I think it's very, very important.
It is very important. And just like you mentioned, Professor, we're all quite happy that COVID wasn't able to overshadow all the many efforts that have been made in order to eradicate malaria. But can you talk to us about the efforts being taken to roll out the vaccine in the hardest hit parts of the world, especially in the places where the trials were conducted in the first place?
Thank you, Howard. Excellent question. I think whenever a vaccine is rolled out, it takes a while for it to indeed begin to be distributed, especially in the rural areas. As it is for Ghana, Kenya, and Malawi, apart from those who were part of the clinical trials, I think that the World Health Organization is just beginning to roll out the structure, the infrastructure with which the distribution of the actual vaccine will be rolled out. And I think over time, individuals will begin to benefit from it, including Nigeria.
Prof?
Yes.
No thanks to COVID and the way the vaccines were expedited in manufacturing, we've seen a massive uptick on vaccine hesitancy. Would this be a barrier in trying to roll out this vaccine to the entirety of Africa?
I don't think it would be a barrier, but it may be a smart move if a combination of both is done in especially rural areas, because people tend to be squeamish about getting jabs on their arms. And so if it's combined, if the delivery of it is done together, I think it will be very efficient. However, I don't think either of them will be a barrier to each other.
Okay, that's actually really good to hear. Professor, can we talk about big pharma for a second? We know that these vaccines and these drugs are created and they're not free. They come at a high cost to whoever creates the vaccine and an even higher cost to whichever body is going to be rolling them out. Any discussions about how this is going to play out, seeing that some of the hardest hit places are third world countries that are battling their own situations? Is there a cost implication, any kind of subsidization, or how is this going to play out in terms of cost?
What we know, however, at this point is that there is a private vaccine organization for developing countries, and they raise funds with which they will subsidize the delivery of the vaccine. I think indeed with Big Pharma, they are private organizations focused for profit. However, in this context, I think with the negotiation with the World Health Organization and this other private organization, there will be some subsidy, towards the delivery of the vaccine.
That's very good to hear as well.
All right. Can you talk to us about some of the side effects of this malaria vaccine?
The side effects are not really significant because with the clinical trials, I've read the, excuse me, I've read the report and also read the publication on Lancet regarding the side effects. And from the report, I didn't see much of the side effects that comes out of that. Now, that doesn't mean there might not be a side effect because once they begin the delivery, that's when you begin to observe the side effects occurring. Sometimes those side effects may not present during the actual clinical trials, especially given the number of people who were involved in the trials. When you roll it out in a whole continent of Africa, then you have volume of people. And that's when perhaps the side effects, if any, will begin to manifest.
Okay, Professor. So we're running out of time. So very quickly, I want to discuss the fact that this is a first for parasitic diseases. Now, malaria, as we know, is a parasitic disease, and it often parasitic diseases, vaccines aren't found for them. So this is a first. What does it say for some other more troublesome parasitic diseases that we have out there?
I suppose what it does is sort of embolden this scientific community to begin to focus on the other diseases similar to malaria. But at this point, there is no known effort towards any other.
All right, Professor. Thank you so much for this discussion this afternoon.